3 more people have with COVID-19 in Canberra, as the ACT records 791 new cases. ACT Health this morning confirmed that a man in his 70s, a man in his 80s and a woman in her 80s had all with COVID-19. Health authorities said 2 of the S occurred within the latest reporting period, but 1 occurred in February. It is unclear why the February was reported by ACT Health today. No information was provided about whether the people who had underlying health issues or were fully vaccinated. The 3 additional S take the total number of Canberrans who have with COVID-19 since March 2020 to 37. There are now 31 people in hospital with the virus in Canberra, including 1 person in intensive care who is being ventilated. Vaccine fatigue is very real, Deputy Chief Health Officer. The ACT's Deputy Chief Health Officer is urging all Canberrans to get their flu vaccines this year. Today the ACT reached the milestone of 70% of Canberrans aged 16 and older having received their COVID-19 booster. 79% of Canberra children aged 5 to 11 have also received a single vaccine dose. In a press conference, ACT Deputy Chief Health Officer Vanessa Johnston said that in the 5-11 age group, almost 11% of children had received their second vaccination in the first 4 days they were eligible. We've also neared the 80% milestone for ACT kids aged 5-11 who've received their first dose COVID vaccination. So we're leading the nation there and we're really proud of that achievement, she said. She said high vaccination rates were especially important because the territory was expecting an increase in cases over the coming weeks, with the emergence of the new BA.2 Omicron strain. It is likely that the proportion of BA.2 cases is increasing, as it is nationally, and indeed globally. So like NSW, the ACT anticipates that the BA.2 strain could become the more dominant strain in coming weeks, she said. To date, there's been no evidence internationally of increased severity of disease or increased risk of hospitalization in BA.2 cases compared to BA.1. We do know that BA.2 is more transmissible than BA.1, but the difference is less than what we see between BA.1 and Delta. Dr. Johnston warned that in the lead-up to winter, health authorities were also preparing for a larger flu season with the return of international travel. She encouraged all people to get a flu vaccine, but acknowledged that some people may be feeling some vaccine fatigue. I think the issue of vaccine fatigue is very real, not just among the Canberra community, who are actually very pro-vaccination on the whole, but nationally, and that's understandable, she said. It's been a long rollout and there's been some complexity and confusion along the way, but I think Canberrans on the whole are really good with taking up health advice. And so we still are really strongly encouraging people to heed that advice, she said.